this is Dr. Harini. Welcome to my YouTube channel Doc Make Couple. Today I'm going to address a very important topic, that is back pain, otherwise low back ache. The term is used as a generalized term for back pain, but the reasons behind the back pain are so wide. The reasons behind are wide, so the protocol should be also wide. There is no generalized back pain magical treatment for all the back pain issues. We have to address each and every root cause of back pain in their own customized protocol treatment. Let me explain the brief anatomy of the spine so that you'll understand the root cause behind the pain at the lower back region. So this is the side view of the spine. If we see from the side view, and this is the posterior view from the behind, and this is the anterior view. Okay, so if we see it from the side view, we have different levels of spine. Okay, this is cervical region, cervical spine here at the neck region, and this is the thoracic spine, and this is lumbar spine at our lower back region, and then here we have sacrum and coccyx. So if we see from the side view, we can see there is concavity, convexity, concavity, convexity. This is normal. The curvature of the spine is normal. So it varies with every level. So the cervical level we have concavity towards inside, and in the lumbar curve also we have concavity. This should not be altered at any cost. So if we see from the posterior view, we have spinous process. If we can touch on the spine, we can palpate it, the spinous process. And this is from the anterior view. Here you can see L1, L2, L3, L4, L5. There are 5 lumbar vertebrae. So between each vertebrae we have gel-like spongy structure. Okay, this is called as disc. You could have heard slip disc. This is the one which got slipped actually. So slip disc is a spongy structure which helps for shock absorption, and it provides nutrients to the vertebrae and the associated structures. These bony protuberances are transverse process, this spinous process, and here the joint between each vertebrae is facet joint, and this is pelvis. This is pelvis, and the junction between the pelvis and sacrum is sacroiliac joint. So this is the brief anatomy of the spine. So coming to the common causes of low back ache, first cause is piriformis tightness. So here we'll have piriformis muscle through which the sciatic nerve emerges from L4, L5 discal root and L5S1 nerve root. Okay, here it emerges out, this yellow color nerve you can see, and from the sacrum level these all nerve roots will combine and form sciatic nerve. Okay, so there will be right sciatic nerve and left sciatic nerve which supplies the backside of the lower limb completely. So if we have piriformis tightness, it compresses the sciatic nerve and will have the tingling sensation and numbness pain down the lower limb. So this is one of the cause, piriformis tightness. Next cause is paravertebral spasm. Okay, this is the posterior view. Okay, this is posterior view, this is spinous process. So the muscles which are adjacent left and right to the spine are called paravertebral muscles. Okay, so if these muscles undergo some spasm, so this we call as paravertebral spasm. Here we will experience pain in the paravertebral region. Cause is TB spine. We call it as pot spine also. Tuberculosis, there is nothing much to explain in it. Tuberculosis for the spine is called TB spine. Cause is the alterations in the lordotic curve. Here we can see there is concavity inside. Okay, from the posterior view, if we see, we can see concavity here. In some conditions, the lordotic curve will increase than normal or decrease than normal. If the lordotic curve increases, it got exaggerated, means we call it as hyperlordosis. If the lordotic curve gets straightened, then it is called hypolordosis. Normally, we can see these conditions during pregnancy or post-pregnancy phase, and who are obese with the protruded abdomen, they tend to walk with hyperlordotic curve. With the protruded abdomen, the curvature, the lumbar curvature concavity will increase, and it increases the pressure on the structures in the lumbar spine. So it's always to tuck your tummy in and to strengthen the abdominals so that the lumbar spine curvature will be maintained in a normal position. Next cause is SI joint dysfunction. I have already told you this is sacrum, the red color one. This is sacrum and this is ilium of the pelvis. So the junction between the sacrum and ilium is SI joint. So if there is some dysfunction in the joint biomechanics while bending or extending your back, so if there is some dysfunction, then it is called SI joint dysfunction. It is also a most common cause of backache. Next cause is facet joint arthropathy. This is nothing but degeneration of the facet joints. Here, facet joints are the place where each vertebrae will join together at this level. So here, if the joint gets degenerated, we'll get the pain at the facet joint levels, both sides. So this is also a common cause. Next cause could be vertebral fracture. So vertebral fracture may happen at any level. It may be due to a fall injury or accident or stress fracture. So if anything happens to the vertebral level, it will be considered as a vertebral fracture. Next reason is the most common reason of lower backache, that is slip disc. In medical terminology, we call it as PIVD, prolapsed intervertebral disc. The name itself says, okay. So the disc should be in between the both vertebrae, in between the vertebrae. If the disc get prolapsed or it has moved anteriorly or posteriorly, it impinges the structures, okay. It impinges the nerve roots in the foramen level, okay. So we have different levels of lumbar spine and lumbar nerve roots emerging out. The most common area where the slip disc happen is between L4, L5 and L5, S1. So we have to take care of how to prevent the slip disc, and we have to follow few ergonomic tips for that. Next cause is ankylosing spondylitis. Here the spine will get fused with calcium deposition. This is also called as bamboo spine. In this, the spinal movement gets limited, and by which the pain is occurred. Sometimes the pain may get radiated from the soft tissue organs also, like the pain, if something happened in the liver or pancreas, the pain gets radiated to the lumbar spine, and we can manifest the pain over here also. So it's always good to consult a physician if you have such issues. So these are the various reasons of the backache. You could have understood now. Like back pain is not a generalized thing. Each and every problem is different. So each and every person is also different. So if someone comes and tells you do this exercise, do that exercise, don't blindly follow them. Okay. Get a customized protocol for each back pain issue, as the reason behind varies with every person and every age, and the severity, like it will be classified into stages: acute, subacute, chronic stages. So the protocol also should be customized for every patient. And mainly I want to address a main point, that is, if we get back pain, we tend to take we normally take painkillers. Does any painkiller corrects these problems? Just answer me. Nothing, right? No painkiller will correct any biomechanical issues in the lumbar spine or SI joint anywhere. So painkiller, the name itself says, painkiller will kill the pain, but it won't decrease the root cause causing the pain. So avoid painkillers and address the issue which is causing the back pain. Always consult a orthopedician or a physiotherapy doctor and get the treatment done at earlier as possible. In coming videos, I'll be explaining the exercise therapy protocol for each of the causes which I've explained earlier. So stay tuned to my channel. Thank you for watching. Don't forget to like, share and subscribe my channel. Thank you.